over normal tissue, no pain, okay? But as soon as we run it over areas of inflammation, poor circulation, arthritis, torn ligament, there's this biofeedback component where you're gonna be like right there. So
so if there's a part that you're fine, you won't feel it.
Yeah, that's the thing. Like if I scan, that's why we'll know in 4 minutes if he's a good candidate, because if I scan,
I'm screaming, then you know.
Yeah,
That's
if you're
a good
screaming
sign.
and I'm smiling, it's because I know the more pain you have during this treatment, the better clinical outcome.
Even though you look like a tough guy, can you indicate if it's more sore than?
Yeah, absolutely.
Oh yeah, you'll
I'm
know.
just curious.
No. And the cool thing is that he'll you can give me like, hey, this is pain level 8, this one's 7, this one's 2, you know, as we're going around. Okay, here we go.
That's starting to go up a little bit more.
What's the pain level there?
Like if you we're tapping on it with a small hammer.
We're gonna have to go to 11. He's pretty strong.
Well, it feels like you got like a little hammer tapping directly on the bone.
Yeah, no,
is what it feels
you're
like.
gonna be like, when I'm on the bad spots, you're gonna be like, oh.
I had a different machine on my tendon once, and that made me break out in sweat.
Yeah, this one does the same thing.
You're getting closer.
Anything?
Yeah, that's good more. I feel like you're tapping
That's
right
the
on
face
the
you
nerve.
want.
Yep, that's in there. Like having a toothache in your shoulder.
Well, that's what's cool, is that we could really find. I want you to be able to say like right there when I'm really in the bad spots. Deltoid tuberosity is a really good one to check.
Yeah, where you get right up towards the curve of the shoulder is where it's probably about the most
The
intense.
humeral head. I'm surprised.
That's
Most
a pretty good one too.
Yeah, comes from forward. And I want you to put your hand up and just kind of press up on my hand. Good. I'm gonna find that bicep tendon. Relax.
Oh yeah, that's
Oh.
that's probably
Okay,
the
Bicep
strongest.
tendon.
So the good thing is this. Now I was at a diagnostic level. Now I'm going to go down to a treatment level. We're going to start your actual first treatment today.
Okay.
So not as diffuse as I thought, right? I didn't find a lot in the rotator cuff, supraspinatus, and you could help me kind of find those.
I would have guessed it's mostly right straight in.
Yeah,
from
it's
there,
kind of like
whatever that is.
transverse ligament bicep tendon type, anterior delt. So
Yeah. Now, I saw that it was getting red there. Is there a reason why it got more red there when you were doing it?
I don't think so. No. There's no damage to the tissue. It's using mechanotransduction.
Yeah, right in there.
That's a bad one. So if I go this way, we'll find out. Is it painful along that line, or is it more painful this
I
line?
think going that way out more from it is more. Yeah, like right out through there.
That's the probably the attachment of the transverse ligament.
Yeah, that's probably where the worst of it is in there. Oh, that one.
How about back here? Anything?
Lower is not as bad. Where you first started was worse.
Supraspinatus. Monique, you're gonna help me with my rotator cuff, where the attachments and origins are today.
That's right there is pretty good too.
I asked where we should go for lunch today in Utica, and he said Taco Bell. Okay, Taco Bell. Terrible.
Crank it
Like
up.
authentic